Hello, and thank you for tuning in. I'm Elyse Gellerman, the CEO of the Net Research Foundation, and I'm talking today with Kalen Fletcher, who is an oncology social worker from Beth Israel Deaconess Medical Center in Boston. And we're going to talk today about COVID-19, neuroendocrine cancer, and taking care of your mental health. Kalen, thanks for taking the time and being with us, and thank you for all of what you're doing on the front lines to help patients and families during this very unusual time.
Well, thank you so much for having me. It's really, really a pleasure to connect with such a fantastic organization. And hopefully, I can provide some helpful information regarding mental health for cancer patients generally, and more specifically, obviously, during this very bizarre, unprecedented, and really, really scary time.
Thank you, Kalen. So I think it's safe to say that everyone is feeling stressed during this moment in time about the changes in our lives, the loss of control over our daily movement and what we're able to do. What are you seeing generally in the community?
Yeah, I will say that I am certainly noticing an uptick in anxiety at the hospital in relation to COVID for both patients and providers. Specifically for cancer patients, this pandemic is creating, as you said, a heightened sense of loss of control for a variety of reasons, which we can touch on a bit more later. And as many cancer patients know, this loss of control tends to lead to increased feelings of anxiety, and other negative feelings and low mood.
And how would this be different or amplified for cancer patients? What are you seeing in your practice?
Yeah, so many patients are experiencing, as I said, an increase in negative feelings. And these feelings that I am seeing are anxiety, stress, worry, fear, loneliness, helplessness, feelings of frustration, and even some anger. And as I said, I think that their cancer patients are feeling these probably more than the general population because, as I said, these feelings are associated with uncertainty. Some cancer patients do have a heightened risk of contracting this virus because they're immunocompromised. So of course that increases these feelings. There's also a lot of uncertainty around treatment schedules. There have been a lot of setbacks, I know, where I practice, and I think it's safe to say across the board. A lot of appointments are being canceled or pushed back. Scans are being canceled or pushed back, lab checks, things like that. And these are really important parts of a patient's routine and really provide a lot of reassurance, as well as contact with, trusted individuals on a person's care team. So these disruptions are really challenging. I will also say that there is a real sense of grief and loss around routine and normality. Many patients that I work with who are dealing with a cancer diagnosis know that it takes a lot of work to kind of create what we call like a new normal. And COVID is really, really making this even more challenging. So things like going for a walk with a friend or going to get coffee are, impossible now or really pose a lot of risk. So that's really hard too. I will also say that I think a lot of the patients I work with are feeling, some grief around not being able to be physically present with their support systems. Of course, we can FaceTime, we can text, we can Zoom. It's not the same as physical presence. And as many patients know, support, social support is one of the best ways to emotionally navigate a cancer diagnosis and treatment. So not having the same type of support is really hard and can lead to some feelings of isolation, which again, I know that many cancer patients often feel isolated, and COVID is really, really amplifying these feelings. So, there are a variety of reasons, and all of them very valid, for which cancer patients are really feeling this, I think, more than the general population.
So this sense of grief is something real, even though it's not related to losing a loved one or losing a person in your life?
Absolutely. Grief can be felt, for a variety of things, and especially a loss of normality. When cancer patients first start treatment or are diagnosed, there's often a huge amount of grief that is felt. Thinking about things that you may not be able to do or partake in. Those are feelings of grief, and they are very real. And as you said, grief is not always associated with the loss of a human.
Kalen, what is the relationship or the need to manage some of these mental health symptoms in relationship to someone's physical health?
Yeah, it's hugely important. Often, mental health symptoms or stress can be felt physically, and these symptoms are often referred to as psychosomatic symptoms. So, in other words, these are physical symptoms such as, GI upset, aches and pains, headache, things like that, that are brought on by emotional distress. So, when we don't deal with or acknowledge the negative emotions we're feeling, it's much more likely that we will experience symptoms like this. With my patients, I often liken this to, a 2-liter bottle of soda that you shake up. And then suddenly you take off the cap and there's this really big explosion. However, when we slowly unscrew the cap little by little, it significantly reduces the chance that there's going to be this type of explosion. And it usually results in, a very small release of carbonation. So, this analogy can kind of be used with emotion. So when we acknowledge our emotions and let them out in a controlled way, we have so much more control over our body's response to this emotion. However, when we bottle these emotions, it often leads to, these psychosomatic symptoms, panic attack, severe depression, having a short fuse with friends and family, things like that. So, acknowledging emotion is really important.
So what are some of the other strategies that you recommend for cancer patients in general and neuroendocrine patients perhaps specifically to really try and manage these symptoms, manage their mood and mental health at this time?
Sure. So I always encourage patients, to set aside a certain time of day to let these feelings out. I find that some patients almost feel guilty letting these feelings out. And I really encourage them to think about them differently. It's important to acknowledge how you're feeling. Some of my patients refer to this time where they let their emotions out as, the time of day when I'm just going to have my pity party. I'm going to cry. I'm just going to feel what I'm feeling. And patients often benefit from literally setting a timer for, the 30 minutes during their day when they're going to feel their feelings. Other people, don't experience this. They are able to kind of emote naturally, but regardless, it's really important to let these emotions out. Journaling is a really helpful tool for letting emotions out and also organizing your thoughts. Oftentimes emotions can become really intense when we let them sit, as I said, keep them inside. And journaling is a really great way to process, even for patients who have never even thought of themselves as a writer or even had a journal before. That's kind of a homework assignment I often give people is to buy a journal. Letter writing is also something that's really, really helpful, and whether you're writing this letter to yourself, to your cancer, to the pandemic, to someone that you're feeling frustrated with, or someone that you're particularly appreciative of right now. It's a really profound way to get emotions out. And, that's whether or not you intend to send the letter. Some people want to send these letters and most people don't. It's just a good way of getting things out. Another effective thing, and something that is really important to think about, is just to consider what you can control right now and what you cannot control. For example, the news, what is on the news, you cannot control. Whether schools are going to open or remain closed, typically we cannot control. What we can control is, what news we choose to watch and how much. We can control what time we are going to wake up in the morning. So it's really helpful to remind ourselves, that there are things within this realm that we can control, and the things we can't, we can't. And kind of making a list of those things can be really helpful. This goes with limiting the amount of news and information around COVID that you're taking in. So, thinking about your day and how much time you're spending reading, looking at Twitter, Instagram, news about COVID, and thinking about, what is in my information diet? What can I kind of do to cull this, to decrease the amount of information and time I'm taking to take in information about COVID, so that I can get the information I need, but not be inundated with it. And then, scheduling your day. I think that is really important. As I said, you can control what time you're waking up in the morning. You can control, the goals you set for yourself for the day, and whether that is taking a walk around the block or watching a TV show or calling a friend. It's really important to set yourself up with a plan for the day. That's imperative. I will also say practicing mindfulness, and that can sound really overwhelming, especially for people like myself who are not born meditators. And I can go over some applications that are really simple to use on your cell phone, and can help with guided meditation and breathing exercises. Those are kind of the pillars of, getting through some of these really tough times and helping to process emotion.
Kalen, you've talked a little bit about resilience and the need for resilience at a time like this. Would you talk about that a little bit, please?
Sure. So, cancer patients, and I don't know that this is always acknowledged, but it has definitely been brought to my attention during this pandemic from my patients. Patients have a lot more tools in what I refer to as a toolbox than the general population in terms of dealing with a pandemic, and the restrictions that it's creating. And it's really, really important to acknowledge that. Many patients I worked with have had to practice social distancing in many forms throughout their treatment, and have had to limit themselves throughout treatment. So I really have found that, these patients are teaching the rest of us about how to cope and deal with this stuff. I have one patient who actually wrote a Facebook post to help her friends and family deal with some of the stress, frustration, and anger they're feeling around being restricted. And the post, to her, the advice she had felt obvious, but it was things that she had picked up from her year and a half of being an immunocompromised person. And it included things like, as I said, planning your day, picking up a new hobby, setting times to FaceTime with friends and family. And, again, it's so important to acknowledge your resilience.
Kalen, what about friends and family and caregivers? How can they help?
That's a good question. And I think, it's important to keep open lines of communication. It's important for friends and family to understand that while this is challenging for everyone, it likely is more challenging emotionally and logistically for cancer patients because, it's affecting their lives in the sense that, their treatment may not be going as planned. Things like that are really, really scary. So it's really important to set aside some time to listen and to be present and available for individuals in your life who are going through a cancer diagnosis during this really unprecedented time.
And what strategies do you recommend to people to balance that with the constant closeness of being in isolation with your family? Because that's stressful in and of itself for many people.
That is really hard. I will say, setting boundaries with the ones we love and are living with, whether that is a parent, a sibling, a friend, a significant other, it's really important to set aside some time where you're not going to interact with that person. It might be, probably is, that you're going to be in very close proximity, but time where you're going to read a book or write in your journal and you're not going to be interacting with that individual. That's super important. It's also really important to have other outlets outside of the individual or individuals you're living with right now. Setting aside time to FaceTime with other people, to text, to call. I will also say that right now, support groups are really important, especially because, connecting with individuals who have cancer and are going through something similarly is hugely helpful. And I will also say that, for those folks who were a part of a support group that was meeting in person, it likely has moved to an online format. So that's something to really consider. And for those who have not ever been a part of a support group, this is actually a great time to consider that because, you don't need to leave your house. And it's something great to try. And most cancer centers and organizations offer support groups like this.
Let's talk about self-advocacy for a bit, because we always talk with patients about feeling free to discuss their questions and concerns with their physicians and members of their care team. But I think that sometimes mental health is a little bit different. Mm-hmm. When you have an oncologist and you have other physicians that you see. How do you encourage self-advocacy and also have that be effective at a time that we know frontline providers are incredibly busy?
So I will say that, I have a lot of patients right now who have a concern, whether it's related to mental health or not. And they're feeling hesitant to reach out to their provider because, as you said, they worry that their providers are so busy with really important other things. And I will say that regardless of what your concern is, it is always valid. You are still a patient, regardless of whether or not we are in a pandemic. And it is imperative that you continue to reach out to your care team with your concerns and questions. And providers really, really feel that way. They want to be hearing from their patients during this time. And typically, concerns, questions can be responded to and answered via a telehealth visit, via, your patient portal or email. Regardless, it remains incredibly important to bring up these concerns with your providers, and they would all say the same thing. In terms of the mental health piece, I think that can sometimes get missed, regardless of whether or not we're in a pandemic, during information-packed visits, which is understandable. However, it is really important to inform your care team if you're feeling, anxious, depressed, because there are ways we can help. And typically, cancer centers or hospitals have mental health clinicians, social workers, psychologists, psychiatrists who have an understanding of oncology and also mental health. And, your care team can connect you to one of those individuals.
So even if you've never used these services before, feel free to reach out and ask for them?
100% yes.
Kalen, we've talked a lot about some of the common symptoms and the strategies for managing this stress and this grief. How do people know when the symptoms become something more serious, as in depression?
Sure.
What to think about and look out for?
So, as I said, a lot of these feelings are really normal, and it's important to process them. However, despite their normalness, it's important to think about how much these symptoms are impacting your day. And I always like to ask patients, how much is your anxiety or your sleeplessness getting in the way of things that you typically like to do? And that's kind of a good way of assessing things. And patients really know themselves well. And if you or if they are feeling like this is really, I'm very uncomfortable, this is getting in the way of my life, it's so important to tell your care team. Specific symptoms that that are important to watch out for are things like feeling like you can't get out of bed in the morning, lack of motivation, sleeplessness, so waking up really many times throughout the night, or the inability to fall asleep, withdrawing from friends and family, the inability to concentrate on anything, whether it's watching a TV show or reading a book, just feeling like, ugh, I can't concentrate. And of course, feeling like thoughts of self-harm, hurting yourself or someone else, those are all symptoms of depression, and they should be reported to your care team, because as I said, there are things that we can do to help. In terms of feeling like you want to hurt yourself or someone else, so suicidal thoughts, suicidal or homicidal thoughts, those are dangerous, and it is important, to call a suicide hotline, and I can give more information about that at the end of this, and also to call 911. It's an emergency if you are feeling like you want to harm yourself or someone else.
Some of the symptoms that you mentioned just a moment ago: trouble sleeping, trouble concentrating, trouble getting out of the bed in the morning. Is it just the repetition of those symptoms or the duration of those symptoms? Because I think from time to time, so many people have said, I'm not sleeping because I'm anxious, or I can't concentrate because of everything going on. So, again, how to recognize kind of that fine line when it becomes something more serious.
I would say that it's always important to tell your care team if you're experiencing any of these things, because as I said, there are things, medications, behavioral techniques we can utilize to help. And we always, want people to have the best quality of life they can. So it's always important to report those symptoms. As a clinician, when I worry most is when those symptoms are taking place for 2 weeks or more. Consistently. That's when I'm thinking more that, that this is going from, normal feelings and emotions to probably something that's more significant, like a major depression or a generalized anxiety.
You mentioned some resources for mental health and coping. One was the hotline number, but can you talk about some other mental health resources that would be very helpful?
Sure. So as I said before, there are a lot of really great mindfulness applications that can be used on a cell phone. I use these often with patients. There's one called Headspace, which is really great. There is also a free app through UCLA called the UCLA Mindfulness app. It's excellent. They really walk patients through guided meditation. And again, patients that I've had who are like, meditation, not for me, have utilized these tools and actually really, really enjoyed them. I will also say, something that I think is going to be posted on your website, which is, coping with COVID. It's kind of a workbook that helps people cope with COVID. And that has been incredibly helpful to my colleagues, but also to my patients. Also, cancercare.org has some really great tools and helpful information around mental health and cancer. And then, of course, the National Suicide Prevention Hotline, which I can provide the number to, and it might be worth, posting on the site. Those are some pretty great sources.
Kalen, any final thoughts as neuroendocrine patients and their families may be watching this conversation?
Yeah, as I said, and I will continue to say, it's always really important to tell your care team about any mental health distress you're experiencing right now. I truly think everyone could use kind of an extra layer of support during this time. And, as I said, there are providers who can be so helpful. So I want to highlight that. And I also just think that generally right now, it's important to be really patient and gentle with yourself. This is a really hard time, and it involves being patient. And again, always alert your care team, especially if there are symptoms you're experiencing that are getting in the way of your life. Yeah, those are kind of my final notes.
Kalen, thank you so much for spending some time with us today. For more information, we will post this conversation and some of Kalen's suggested resources on our website, which is netrf.org. You can click on the orange banner for additional mental health and well-being resources. Kalen, thank you so much. Have a good weekend. And again, our gratitude for everything that you and your teams are doing to help patients during this emergency.
Thank you so much. It's been a pleasure.